Welcome to another episode of the News Roundup. On today's show, we're going to be discussing two parents who are now suing CVS for mistakenly injecting their two young boys with an adult dose of the COVID-19 vaccine, rather than the seasonal flu shot that they went into the store to get. And so, from Trial Site News, I am Adrian, and our episode starts right now. Back in October 2021, two children received adult doses of the Pfizer COVID-19 vaccine in Louisville, Kentucky. This according to initial reports by local media WDRB. According to the report by the Lexington Herald-Leader, the morning after the shots were given and before the family had been notified by CVS, one of the children complained of a pain in his leg. And according to the parents, by the time he got to school, it was hurting so badly it was compromising his ability to walk. Both children had negative side effects after receiving the vaccine, and their parents feared that their boys suffered mental damage as well. According to the lawsuit, the parents said that they also now live with continuous concern, worry, and fear regarding what long-term effects that may suffer after receiving vaccines that were not approved for children their age. The CVS located on Taylorsville Road in Jeffersontown is asserting that a technician at this location grabbed the wrong shots for the boys by mistake. At the time of this incident, back in early October, the vaccines were not yet authorized for people under the age of 12. CVS's communication manager, Amy Thibault, put out a statement on the matter saying that on Monday, October 4th, at our pharmacy on Taylorsville Road in Jeffersontown, two minor patients inadvertently received COVID-19 vaccinations when they requested flu vaccinations. The error was disclosed to the patient's parents immediately. Out of an abundance of caution, we recommended that the parents notify the patient's primary care physician. We are reporting this incident to HHS's Vaccine Adverse Event Reporting System, or VAERS, and are taking steps to help prevent this from occurring again. Now, while it is true that pharmacies establish systems, processes, and protocols designed to prevent incidents like these from happening, it still does happen from time to time. In this case, once it did occur, CVS reported the incident to the CDC's Vaccine Adverse Event Reporting System and shared with local media WDRB that the company was taking steps to help prevent it from occurring again. The parents in the lawsuit, though, are suing for malpractice, negligence, emotional distress, and battery, and seek $75,000 from the pharmacy chain, while their attorney suggests this incident showed malicious behavior by the defendant. As reported by the Lexington Herald-Leader, the plaintiffs argued that CVS knew or should have known in light of the unknown and rapidly developing science regarding COVID-19 vaccines, especially the lack of any FDA approval for minor children at the time of the wrongly administered vaccines, that their conduct would naturally and probably result in injury and damages. The CDC has said that vaccine administrations are told by the U.S. Centers for Disease Control and Prevention to use the correct formulation for each age group. The formulations are not interchangeable. Now, this isn't the first time this type of occurrence of giving children wrong doses of the COVID-19 vaccine have happened. For example, in Georgia, back in December, a local parent made the news after her 7-year-old was given the adult dose of the COVID vaccine at a Walgreens. The mother said that her daughter had been complaining since Sunday that her arm is very sore. She has had a very hard red knot on her arm. Walgreens put out a statement on the matter saying that, in general, events like these are rare and we take this matter very seriously. In the event of any error, our first concern is always for a patient's well-being. Our multi-step vaccination procedure includes several safety checks to minimize the chance of human error, and we have received this process with our pharmacy staff in order to prevent such occurrences. Local news Fox 10 shared a quote from a volcanologist from the Johns Hopkins Bloomberg School of Public Health declaring that if a child receives an incorrect vaccine, any side effects should resolve after a day or so. This according to Kausar Talat. She said that the biggest consequence is you have a little bit more side effects, but they tend to be short-lived. Be careful, ask questions, but I don't think it's something you really have to worry about. Kausar also claimed that despite having stronger immune systems, vaccines still help children who have still been victims of this deadly pandemic. However, it should also be noted that the World Health Organization recently put out a notice about the risks of myocarditis and pericarditis post-COVID-19 or mRNA vaccines for younger men and adolescents. Here's what they said on the matter. The COVID-19 subcommittee of the World Health Organization Global Advisory Committee on Vaccine Safety, or the GACVS, issued a statement regarding reports of myocarditis and pericarditis following COVID-19 mRNA vaccines. Cases of myocarditis and pericarditis, although rare, have occurred more often in younger men, meaning adolescents or young adults, and after the second dose, typically within a few days after vaccination with the COVID-19 mRNA vaccines. As of June 2021, U.S. VAERS surveillance data estimated crude reporting rates of 40.6 cases per million second doses among males and 4.2 cases per million among females aged 12 to 29. Current evidence suggests a likely causal association between myocarditis and the mRNA vaccines, and that some, but not all, data suggest a higher incidence of myocarditis after a second dose of the COVID-19 vaccine from Moderna, or Spikevax, and the mRNA vaccine from Pfizer, Comirnaty, in young males, although they noted that the overall risk was small. The GACVS COVID-19 subcommittee also noted that myocarditis can occur following SARS-CoV-2 infection, and that mRNA vaccines have a clear benefit in preventing hospitalizations and death from COVID-19. They cautioned, though, that countries should continue to monitor reports of myocarditis and pericarditis following vaccination by age, sex, dose, and vaccine brand. Countries should consider the individual and population benefits of immunization relevant to their epidemiological and social context when developing their COVID-19 immunization policies and programs. And finally, on the matter, the WHO in their statement said that available data suggests that the immediate course of myocarditis and pericarditis following vaccination with both vaccines is generally mild and responds to treatment. Follow-up is ongoing to determine long-term outcomes. Vaccinated individuals should be instructed to seek immediate medical attention if they develop symptoms indicative of myocarditis and pericarditis, such as new onset and persisting chest pain, shortness of breath, or palpitations following vaccination. Interesting. In the meantime, parents of the two Kentucky young boys have sued CVS, and the case is titled Hobbs et al. Versus CVS Pharmacy, and is overseen by Judge Greg Stivers in the Kentucky Western District Court, and is classified as diversity and medical malpractice cause of action. A case which, of course, we will be keeping you posted on as it develops. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.